51. Which hormone is primarily responsible for regulating blood pressure in the adrenal gland? Answer: aldosterone. Explanation: aldosterone regulates blood pressure by controlling sodium and water retention, critical for assessing fluid balance in endocrine disorders like hyperaldosteronism. 52. What is the primary nursing action for a patient with a blood glucose level of 45 milligrams per deciliter who is alert? Answer: provide oral glucose. Explanation: providing oral glucose, like juice, raises blood glucose quickly in alert hypoglycemic patients, a critical intervention to prevent neurological harm and ensure safety. 53. Which gland is responsible for thyroid hormone secretion? Answer: thyroid gland. Explanation: the thyroid gland secretes thyroid hormone to regulate metabolism, critical for assessing energy levels and guiding treatment in endocrine disorder management. 54. What is the primary symptom of a patient with diabetic retinopathy? Answer: blurred vision. Explanation: blurred vision, due to retinal damage in diabetic retinopathy, guides ophthalmologic referrals and blood glucose control to prevent further endocrine complications. 55. What is the priority nursing action for a patient with suspected hypocalcemia? Answer: administer calcium gluconate. Explanation: administering calcium gluconate corrects hypocalcemia, preventing neurological complications like tetany, a critical intervention for endocrine patient safety. 56. What is the primary patient education topic for a patient with Addison's disease? Answer: carry emergency hydrocortisone. Explanation: teaching patients to carry emergency hydrocortisone prevents adrenal crisis, a critical step to ensure endocrine stability and patient safety in stressful situations. 57. Which laboratory test confirms Cushing syndrome? Answer: elevated cortisol levels. Explanation: elevated cortisol levels confirm Cushing syndrome, guiding endocrine assessments and interventions to manage metabolic and cardiovascular complications. 58. What is the primary nursing intervention for a patient with hyperthyroidism experiencing palpitations? Answer: administer beta blockers as prescribed. Explanation: beta blockers reduce palpitations in hyperthyroidism by slowing heart rate, a critical intervention to ensure cardiovascular stability and patient comfort. 59. Which hormone is deficient in hypopituitarism? Answer: multiple pituitary hormones. Explanation: hypopituitarism involves deficiency of multiple pituitary hormones, guiding hormone replacement therapy to restore endocrine function and patient health. 60. What is the primary symptom of hypercalcemia in a patient with hyperparathyroidism? Answer: confusion. Explanation: confusion, due to elevated calcium levels, signals hypercalcemia, guiding neurological assessments and interventions to ensure patient safety in endocrine care. 61. Which gland regulates blood glucose through insulin secretion? Answer: pancreas. Explanation: the pancreas secretes insulin to lower blood glucose, critical for assessing metabolic control in endocrine disorders like diabetes mellitus. 62. What is the primary nursing action for a patient with a blood glucose level of 350 milligrams per deciliter? Answer: administer insulin as prescribed. Explanation: administering insulin lowers high blood glucose, a critical intervention to prevent hyperglycemia complications like ketoacidosis in endocrine management. 63. Which hormone is oversecreted in a patient with a pheochromocytoma? Answer: catecholamines. Explanation: excess catecholamines cause hypertension in pheochromocytoma, guiding endocrine assessments and interventions to manage cardiovascular risks and ensure stability. 64. What is the primary patient education focus for a patient with hypothyroidism on levothyroxine? Answer: take medication on an empty stomach. Explanation: teaching patients to take levothyroxine on an empty stomach ensures optimal absorption, a critical step to maintain thyroid function and prevent endocrine complications. 65. Which laboratory test monitors blood glucose control in a patient with diabetes? Answer: hemoglobin A1C. Explanation: hemoglobin A1C reflects average blood glucose over months, guiding diabetes management to prevent endocrine complications and ensure patient health. 66. What is the primary nursing intervention for a patient with suspected diabetic ketoacidosis? Answer: administer intravenous fluids. Explanation: intravenous fluids correct dehydration in diabetic ketoacidosis, a critical intervention to stabilize endocrine function and prevent circulatory collapse. 67. Which hormone is deficient in primary adrenal insufficiency? Answer: cortisol. Explanation: cortisol deficiency in primary adrenal insufficiency causes fatigue, guiding hormone replacement to restore endocrine balance and patient energy levels. 68. What is the primary symptom of a patient with growth hormone deficiency? Answer: short stature in children. Explanation: short stature, due to growth hormone deficiency, guides pituitary assessments and hormone therapy to support development in pediatric endocrine care. 69. What is the primary nursing action for a patient with a blood glucose level of 25 mg per deciliter who is unresponsive? Answer: administer glucagon. Explanation: administering glucagon raises blood glucose in unresponsive hypoglycemic patients, a critical intervention to restore consciousness and ensure patient safety. 70. Which gland is responsible for parathyroid hormone secretion? Answer: parathyroid gland. Explanation: the parathyroid gland secretes parathyroid hormone to regulate calcium, critical for assessing bone and neurological health in endocrine disorder management. 71. What is the primary patient education topic for a patient with type 1 diabetes? Answer: insulin administration technique. Explanation: teaching proper insulin administration ensures effective blood glucose control, a critical step to prevent complications and ensure endocrine patient safety. 72. Which hormone is oversecreted in prolactinoma? Answer: prolactin. Explanation: excess prolactin in prolactinoma causes symptoms like galactorrhea, guiding endocrine assessments and interventions to manage pituitary function and patient health. 73. What is the primary nursing intervention for a patient with suspected myxedema coma? Answer: administer intravenous levothyroxine. Explanation: intravenous levothyroxine reverses severe hypothyroidism in myxedema coma, a critical intervention to restore metabolic function and ensure patient safety. 74. Which laboratory test confirms diabetes mellitus diagnosis? Answer: fasting blood glucose. Explanation: a fasting blood glucose level of 126 mg per deciliter or higher confirms diabetes, guiding endocrine management to prevent complications and ensure patient health. 75. What is the primary symptom of hypoglycemia unawareness in a diabetic patient? Answer: lack of warning signs. Explanation: lack of warning signs in hypoglycemia unawareness increases seizure risk, guiding frequent glucose monitoring to ensure endocrine safety and stability. 76. What is the primary nursing action for a patient with a blood glucose level of 500 mg per deciliter? Answer: notify the healthcare provider. Explanation: notifying the healthcare provider ensures rapid intervention for severe hyperglycemia, a critical step to prevent ketoacidosis and ensure patient safety. 77. Which hormone is deficient in diabetes insipidus? Answer: antidiuretic hormone. Explanation: antidiuretic hormone deficiency causes excessive urination in diabetes insipidus, guiding desmopressin therapy to restore fluid balance and ensure patient safety. 78. What is the primary patient education focus for a patient with Cushing syndrome? Answer: monitor weight gain. Explanation: teaching weight gain monitoring helps manage Cushing syndrome symptoms, a critical step to reduce cardiovascular risks and ensure endocrine health. 79. Which gland regulates stress response through cortisol secretion? Answer: adrenal gland. Explanation: the adrenal gland secretes cortisol for stress response, critical for assessing metabolic stability in endocrine disorders like adrenal insufficiency. 80. What is the primary nursing intervention for a patient with suspected thyroid storm? Answer: administer propylthiouracil. Explanation: propylthiouracil inhibits thyroid hormone synthesis in thyroid storm, a critical intervention to reduce metabolic rate and ensure patient safety in emergencies. 81. Which hormone is oversecreted in hyperparathyroidism? Answer: parathyroid hormone. Explanation: excess parathyroid hormone causes hypercalcemia, guiding endocrine assessments and interventions to manage skeletal and neurological complications. 82. What is the primary symptom of a patient with diabetic nephropathy? Answer: proteinuria. Explanation: proteinuria, due to kidney damage in diabetic nephropathy, guides renal assessments and blood glucose control to slow endocrine disease progression. 83. What is the primary nursing action for a patient with a blood glucose level of 200 mg per deciliter post-meal? Answer: monitor for hyperglycemia symptoms. Explanation: monitoring for hyperglycemia symptoms like thirst ensures early intervention, a critical step to prevent complications and ensure endocrine patient safety. 84. Which laboratory test monitors adrenal function in Addison's disease? Answer: ACTH stimulation test. Explanation: the ACTH stimulation test assesses cortisol response in Addison's disease, guiding hormone replacement to restore endocrine balance and patient health. 85. What is the primary patient education topic for a patient with hyperthyroidism? Answer: regular thyroid function tests. Explanation: teaching regular thyroid function tests ensures timely hyperthyroidism management, a critical step to prevent complications and maintain endocrine stability. 86. Which hormone is deficient in hypoparathyroidism? Answer: parathyroid hormone. Explanation: parathyroid hormone deficiency causes hypocalcemia, guiding calcium supplementation to prevent neurological complications and ensure patient safety. 87. What is the primary nursing intervention for a patient with suspected adrenal crisis? Answer: administer intravenous hydrocortisone. Explanation: intravenous hydrocortisone replaces cortisol in adrenal crisis, a critical intervention to prevent shock and ensure patient safety in endocrine emergencies. 88. Which gland is responsible for growth hormone secretion? Answer: pituitary gland. Explanation: the pituitary gland secretes growth hormone, critical for assessing developmental disorders and guiding endocrine treatment in clinical practice. 89. What is the primary symptom of hyperaldosteronism? Answer: hypertension. Explanation: hypertension, due to excess aldosterone, guides endocrine assessments and interventions to manage fluid balance and cardiovascular risks in patient care. 90. What is the primary nursing action for a patient with a blood glucose level of 70 mg per deciliter before exercise? Answer: provide a carbohydrate snack. Explanation: providing a carbohydrate snack prevents exercise-induced hypoglycemia, a critical intervention to ensure endocrine stability and patient safety during activity. 91. Which hormone is oversecreted in acromegaly? Answer: growth hormone. Explanation: excess growth hormone in acromegaly causes enlarged features, guiding pituitary assessments and interventions to manage endocrine complications. 92. What is the primary patient education focus for a patient with type 2 diabetes? Answer: weight management. Explanation: teaching weight management improves insulin sensitivity in type 2 diabetes, a critical step to prevent complications and ensure endocrine health. 93. Which laboratory test confirms hypopituitarism? Answer: low pituitary hormone levels. Explanation: low levels of pituitary hormones confirm hypopituitarism, guiding hormone replacement therapy to restore endocrine function and patient stability. 94. What is the primary nursing intervention for a patient with suspected diabetic foot infection? Answer: administer antibiotics as prescribed. Explanation: administering antibiotics treats diabetic foot infections, a critical intervention to prevent amputation and ensure patient safety in endocrine care. 95. Which gland regulates blood glucose through glucagon secretion? Answer: pancreas. Explanation: the pancreas secretes glucagon to raise blood glucose, critical for assessing metabolic control in endocrine disorders like hypoglycemia. 96. What is the primary symptom of a patient with thyroid cancer? Answer: neck mass. Explanation: a neck mass, often painless, signals thyroid cancer, guiding endocrine assessments and surgical referrals to ensure timely treatment and patient safety. 97. What is the primary nursing action for a patient with a blood glucose level of 300 milligrams per deciliter? Answer: administer insulin as prescribed. Explanation: administering insulin lowers elevated blood glucose, a critical intervention to prevent hyperglycemia complications like hyperosmolar state in endocrine care. 98. Which hormone is deficient in Hashimoto's thyroiditis? Answer: thyroid hormone. Explanation: thyroid hormone deficiency in Hashimoto's thyroiditis causes hypothyroidism, guiding levothyroxine therapy to restore endocrine function and patient energy. 99. What is the primary patient education topic for a patient with adrenal insufficiency? Answer: recognize adrenal crisis symptoms. Explanation: teaching recognition of adrenal crisis symptoms like weakness ensures timely intervention, a critical step to prevent shock and ensure endocrine safety. 100. What is the primary nursing intervention for a patient with suspected hypercalcemia? Answer: administer intravenous fluids. Explanation: intravenous fluids promote calcium excretion in hypercalcemia, a critical intervention to prevent neurological complications and ensure patient safety.